ABC of diabetes, a comprehensive guide to diagnosis, treatment, and care. Diabetes is one of the most prevalent chronic conditions worldwide, affecting millions of people. Proper diagnosis, management, and prevention strategies are crucial to improving health outcome. Provide a comprehensive structured approach to diabetes care, making it ideal for healthcare professional, medical student, and caregiver. This course explores the pathophysiology, clinical presentation, complications, management strategies, and the new advancement in diabetes treatment. Learner will gain a solid foundation in evidence-based diabetes care, focusing on patient-centered approach and the multidisciplinary management. The course objective: by the end of this course, learner will be able to identify different types of diabetes and their diagnostic criteria, understanding the role of lifestyle, medication, and insulin therapy in diabetes management, recognize acute and chronic complications of diabetes, implement preventive strategy to reduce the risk of diabetes and its complications, support patients with self-management strategies and psychological well-being, apply emerging treatment and digital health tools in diabetes care. Module 1: ABC of diagnosis of the diagnosing diabetes, understand the diagnostic criteria and the screening method, definition of diabetes and its impact on health, criteria for diagnosis diabetes, fasting plasma glucose, HbA1c, OGTT, screening in high-risk population, obesity, family history, gestational diabetes, differentiation between type 1, type 2, and the gestational diabetes, importance of early diagnosis in preventing complication. Module 2: ABC of diabetes, classification, causes, and disease mechanism, overview of type 1, type 2, and gestational diabetes, pathophysiology, insulin resistance versus insulin deficiency, genetic and environmental factor contributing to diabetes, secondary forms of diabetes, pancreatic disease, steroid-induced MODY, ABC of living with diabetes, lifestyle modification and coping strategy, importance of education and self-care, dietary recommendation, carbohydrate counting, glycemic index, exercise and its effect on blood glucose, emotional and psychological challenges of living with diabetes, ABC of early detection and prevention, identify risk and strategies for diabetes prevention, prediabetes and the early intervention, pre-diabetes and the early intervention, lifestyle modification for diabetes prevention, role of weight management in reducing diabetes risk, public health strategy for diabetes prevention, ABC of cardiovascular disease in diabetes, managing heart health in diabetic patient, link between diabetes and the cardiovascular disease, role of hypertension, dyslipidemia and atherosclerosis, cardiovascular risk assessment in diabetic patient, management strategies, lifestyle changes, statin, antihypertensive therapy, ABC of glucose management, type 2 diabetes, treatment strategy for optimal glycemic control, setting blood glucose target for type 2 diabetes, oral hypoglycemic agent, metformin, sulfonylurea, SGLT2 inhibitor, DPP4 inhibitor, non-pharmacological intervention and lifestyle adjustment, ABC of hyperglycemic emergencies and hospital care, recognizing and managing acute diabetic complication, diabetic ketoacidosis, cause, symptoms and management, osmolar hyperglycemic state and the treatment strategy, managing diabetes in hospital patient, importance of fluid and electrolyte management, ABC of insulin therapy, types of administration and patient education, indication for insulin therapy in type 1, type 2 diabetes, type of insulin, rapid acting, long acting, mixed insulin regime and dose titration, injection technique and patient education, ABC of hypoglycemia in diabetes, cause, symptoms, definition and classification, cause, medication, symptoms and recognition of hypoglycemia, treatment option, ABC of self-management in diabetes, empowering patient through education and monitoring, importance of self-monitoring blood glucose, diabetes self-management program, adjusting lifestyle and medication, complication and surveillance, detection and prevention of long-term effect, ABC of kidney disease in diabetes, understanding and managing diabetes nephropathy, how diabetes affects kidney function, stages of diabetic nephropathy, ABC of eye disease in diabetes, screening and prevention of diabetic retinopathy, ABC of diabetic foot care, prevention, management and best practice, risk factor for foot ulcer and amputation, foot care guidelines for patient, ABC of diabetic neuropathy, types, symptoms and treatment, peripheral, autonomic and focal neuropathies, pain management and rehabilitation, ABC of psychological aspect of diabetes, addressing mental health and emotional well-being, diabetes distress coping strategy, the role of behavioral therapy in diabetes care, ABC of diabetes and pregnancy, managing gestational and pre-existing diabetes, risk associated with diabetes during pregnancy, blood glucose management for health pregnancy, ABC of diabetes care in general practice, optimize healthcare system for better patient outcome, role of primary care in diabetes management, team-based care and the multidisciplinary approach, ABC of new and emerging diabetes therapy, innovation in medication and the treatment strategy, support for people with diabetes, building strong network for better diabetes management. This course provides a holistic and evidence-based approach to diabetes care, covering everything from diagnosis to management, complication, and future therapy. It's designed for healthcare professionals, medical students, nurses, and caregivers who wants to deepen their understanding of diabetes and improve patient outcome.